Hi, and welcome back to Unmasking the Trans Movement with Jon Uhler. I'm your host, Brad Wilder. Today on the show, Jon Uhler, Dr. Ann Gillies, and Dr. Van Mol sit down to talk about the dangers of the trans movement. There's more to come right after these.
Do you notice a change in your child? Do you wonder what's going on with my child? Do you finally see something others have been seeing for some time now? Do you see the ideology and indoctrination after your child returns home from school every day? Do you see? Yes, you do see the harm and the confusion they are causing. Do you see the role they are playing on your child's life and development? Do you see? Yes, you see now. And now you have questions. At Unmasking the Trans Movement, we're here to help answer those tough questions you can't ask anyone else, or answers that are hard to find. We discuss the many topics of this evil agenda indoctrinating our children into a world of self-destructive deviance, constant medical care, and human degradation. Our webinars provide access to supporting groups discussing the tough issues you want to talk about with real parents and experts alike. Sign up and become a member now and you'll save 30% off your first-time membership starting at just $7. Select from our bronze, silver, and gold packages, all with different options depending on your needs. Our mission is clear: to unmask the deception and protect the most vulnerable among us, women and children. For webinar dates, times, and pricing, please visit our website at unmaskingthetransmovement.com/webinars.
Welcome back. Today on the show, Jon Uhler, Dr. Ann Gillies, and Dr. Van Mol will discuss the dangers of the trans movement. The trans movement is being unmasked right here on our program, and we're bringing you every single bit of detail we possibly can to help parents, grandparents, and children alike. Thanks for being here today, everyone. Let's jump right in with all three of you, Jon, Dr. Ann, and Dr. Van Mol.
Brad, thank you once again. We do have an expert with us, a medical doctor, Dr. Van Mol. He has been in practice for years. He also was a flight surgeon. He has a lot of experience, and he found himself getting into, out of reason for ethics, needing to get involved. And that's really, Dr. Gillies, what brought you into this, what brought me into this. We were really pulled into this because how can we stand by and watch a grand scheme, a lie, a deception, a ruse, a strategy that places, it just doesn't place kids in harm's way, it actually brings harm upon them when we are to do no harm. Dr. Gillies, thank you for being back. Do you want to introduce Dr. Van Mol?
Well, I will. And we just had a wonderful first segment with you, Dr. Van Mol. I'm excited because you are bringing such current truth, and it's relevant truth, but it's truth that's been true all along regarding this whole transgender movement and the propaganda. And so the research that you shared with us and your critique of this new HHS document from the last segment is people need to listen to that right away. But we want now for you just to continue. You have a wealth of experience, as Jon was saying. You have been doing such deep dives in the research area. And in this whole area, there's this whole thought. Well, it's more than the thought. It's the propaganda that these young people are at risk because of society and because of our attitudes and because of parents' attitudes, and that the suicide rates are very high because of stigmatism. You clarified that the last time. I kind of wanted to finish up the HHS document first, and then we can move on to some other stuff I think that you would like to talk about. So why don't we go back to that document, finish up your notes on it, and then we'll press forward.
Great, thanks much. Moving on page 3 here of that document, it says supportive families and caregivers, peers in schools and community environments are all associated with improved mental health and well-being. Well, supportive of what? Support the child, yes, but support the delusion that's not a good idea. And by the way, so many of these studies, that claim victory, oh, look at all these good results, it's exclusively self-reported data. And that's like a consumer satisfaction survey. It really doesn't give you any idea of what the objective truth is underneath. And, again, as we said before, decades of literature show that in gender dysphoric youth, gender confused youth, is the overwhelming probability of underlying mental health problems, adverse childhood experiences, bad family dynamics, and an unusually high percentage of autism spectrum disorder. Those are what need to be dealt with. Again, the artful phrasing of things in this document is something they keep hammering on the stigma and discrimination. As we talked about, the last episode, stigma does not hold up to scrutiny as any kind of a major cause of mental health problems or suicidality. In fact, the mental health problems predate the gender dysphoria. See if there's anything else here. Oh, yes. And they say that LGBTQ teenagers, again, because of stigma and discrimination, continue to face extremely high levels of violence and mental health challenges. That is a stat that really needs to be challenged. How much of that violence is actually from intimate sexual partners? And there's plenty of data on that in fact, that's a higher cause than anything having to do with stigma. You're being abused by other people in the same community. In California, the Blue Shield of California Trust joined together with the Gay and Lesbian Medical Association, and this was in the early 2000s, for to have this statewide project to inform doctors of how prevalent intimate partner violence was in sexual minority relationships, and that we had to be looking for it and screening for it. There's all kinds of evidence, additional evidence of this, but intimate partner violence is a significant source of problem. And of course, that's a third rail you're not allowed to discuss.
And let me also jump in, because you just highlighted something, Dr. Baumol, that the dirty little secret within the pushers of the trans deception is pornography. So in so many of these so-called relationships, you have oftentimes you have abuse going on, where you have somebody who is manipulating somebody else or exploiting somebody else, or like out in California now, where they said that a 15-year-old, you like how they phrase it, a 15-year-old and a 24-year-old. Really? Now that means a young high school student is somebody, and notice Senator Scott Wiener out of the Bay Area is the one to push all this diabolical stuff. Well, gee, he and his cadres, isn't that interesting, want to get their hands on these young high school kids, these boys, so that if that happens and they get busted, they can do plea deals and never have to end up on the registry. So you just nailed it, that in so many of these quote unquote relationships, you have a lot of pornography that tends to become very violent, and it changes the male brain, and therefore you oftentimes have this intimate, quote unquote, intimate partner violence. So that was spot on.
Yeah. And then they also say that, half of the sexual minority students had recently experienced poor mental health. Like, if you ask it that way, but it's going to way predate their identification with sexual minority status. So it's kind of artful to say, oh, they experienced it in the past year, as though it were something, new, acute, and caused by outside influences, when really the problem's internal. It's time to quit blame shifting if we're really going to help these kids. And then saying 22% attempted suicide in the past year. Be really careful with those reports of, this ridiculously high level of suicidality. First of all, there's a difference between non-suicidal self-injury and an actual suicide attempt. They're not one and the same. And often, again, we're talking about the underlying problems, things like borderline personality disorder. One of the demarcation points for it is the manipulative behavior, a high rate of attempted suicide, and then also in just plain old depression and anxiety, the idea of NSSI, non-suicidal self-injury, being the proverbial cry for help. I need help, and this is how I'm going to get attention. So, a golden rule here is to never accept the results of a study or statistics at face value. You need to see where these numbers came from, how they were generated. And a lot of these studies that claim this, super high level of suicidality do not hold up to scrutiny. There's better studies out there that defeat these. but that's not what's being put forward by the activist groups.
Well,
Last thing here, if I can.
Okay.
HHS policies, HHS policy prioritize, sorry, I'm having trouble here. Priorities for improving the mental health of and reducing substance use. It's like, again, you know, substance abuse means there's a problem going on that someone's trying to self-medicate with. And the problem's not stigma, and it's not, you know, prejudice and these other things they bring up. Yes, those things exist. And no, nobody should be bullied, but bullying is a rather universal experience. Everybody's been bullied to some degree. And again, as we talked about the last hour, that study out of Finland, out of one of their main gender clinics, they found that transgender identification is more associated with being the bully than actually being bullied, even in the presence of having been bullied. So that bullying thing needs to be assessed because it works two ways.
Kelly J. Keane just experienced that over in New Zealand, right? She barely escaped with her life. She and her rally, here's a threatening rally, ready? Let women speak. Well, right, they descended upon her nearly, you know, if they had gotten, it's all these deviant guys, but it was kind of headed up by a number of women, some in the, some lawmaking positions that have close ties to big pharma. So Jennifer Billick did a really nice expose on, listen, who are some of these women that got all these deviant men all riled up to where these deviant men were attacking Kelly J. Keane. And she said, listen, follow the money. So Dr. Von Moll, do you have anything else on this document? Because I will show the document just since those that may just be tuning into part 2. I don't want to cover your notes up. So do you have anything else you want to add to it before at least I show them?
Go right ahead.
So we'll show the document. This again just came out from healthandhumanservices.gov. So I recommend that our viewers go and look that up. Right, it's new HHS report. I'm just reading this, released on Transgender Day of Visibility. You notice they changed that. That was going to be the Day of Rage or something, just on the heels of a transgender mass murderer walking into a church, hunting down kids. What I heard is she may have been hunting down the pastor's kids. These are homicidal maniacs now. And that's a big part of, so this is the document that Dr. Von Moll has been referencing. But Dr. Von Moll, you just presented at a conference, I believe I want to say in Texas.
That's right.
So share with us, but at some point in time, before we leave today, I really would love your commentary on the dangers of, we had, first of all, we had Dr. Cretella on. She was talking about the amount of hormones these kids are placed on are just out of control.
Oh, yeah.
So do you want to add anything to that as far as addressing your concerns as a physician? What are we doing to these kids when they're being put on these hormones?
Yeah, let's start with that. Again, these are not benign, you know, interventions. In the case of puberty blockers, you're interfering with fertility, and if you're on them long enough, you're infertile. And there's studies out there that show that even if you haven't been on it, you know, all that long, going off of it still can have side effects that go on for years, even indefinitely. And again, that's in the peer review literature. But the immediate risks are to your fertility, next to your sexual function, you know, and the problems that are going to go on there. Anorgasmia, you know, inability to have orgasms with time. The sex organs are going to stay in their underdeveloped state and the problems that can lead to. The effects on bone development, and that's pretty well established. The effects on brain development. And it's like, well, if you go off to puberty blockers, do you get to hit those milestones again? We don't know. How can something be out there for decades and that still results in we don't know. So psychological functioning, brain development, fertility, sexual function, you know, the bone maturation and stuff. Cross-sex hormones, you're talking about massively super physiologic doses of testosterone that a female body would never see short of an endocrine cancer, you know, that kind of thing. They're just no way naturally, short of some kind of severe disease state, your body would ever see that kind of stuff. So in the case of estrogen in a biologic male, strongly increases the risks of blood clots, heart attacks, stroke, breast cancer, insulin resistance, and obviously the possibility of premature diabetes. And the risks increase with the length of time that you're on it. And I don't just mean an arithmetic; it's exponential. I mean, it's incredible increases in risk just having been on it, 3, 4, 5 years kind of thing. Testosterone use in a biologic male strongly increases the risk of heart attacks, strokes, breast and uterine cancer, hypertension, severe acne, and other things. And this is something I keep going over with patients in my office that are, simply women that are being told by some marginal specialist out there, oh, you want to be on testosterone as well as hormone replacement now that you're postmenopause. A 2019 international review, endocrine societies from around the world invited to join in this. And they asked them, what does the literature confirm is the supported use of testosterone in women? They found 1, short-term use for hypoactive sexual desire disorder. They said there were no exceptions, including prevention, and that the long-term safety of testosterone use in women had not been established. Now we're not talking about incredibly high doses. You're talking about a little supplemental testosterone. What's being done to these young girls with gender confusion is they're being put on what would be 20, 50 times the amount of testosterone their body would ever see. The results aren't going to be good. And again, this is why we have these comprehensive literature reviews. And to be specific, out of the UK was the National Institute of Healthcare Excellence, which goes by the acronym NICE, the NICE review of puberty blockers, the NICE review of cross-sex hormones, and the CAS review that only the release of the interim report resulted in the closing of the world's largest pediatric gender clinic in the UK. So that's 2.5 out of the UK, with the full third still pending. In Sweden, one of their agencies, did a comprehensive review. In Finland, Cohere Finland, a division of government, did the same thing. And these were lead engines in driving gender transition procedures for kids. And they did a complete 180 based on the evidence. Why? Because all these comprehensive reviews showed that the actual strength of evidence support was low to very low for all of the claims, for cross-sex hormones, for puberty blockers, and let alone, for surgery that minors shouldn't be getting for any reason. The state of Florida, in their efforts, and Truth in Advertising have been contracted working with the state of Florida throughout this whole process of theirs. But they released a GAPMS report, Generally Accepted Professional Medical Standards, part of which was a team out of McMaster's University, and they were, so-called agnostic on the subject. They didn't have an opinion one way or the other. They did a comprehensive literature review, same results, low to very low quality evidence, with one exception. Moderately high evidence supported the harms.
Wow.
How's that?
Oh, from McMaster.
So, yeah, and I don't know if we should put the university's name on it, but
No.
the researchers are from there. And though, to my knowledge, those are the comprehensive lit reviews that exist in the world. 2.5 out of the UK, 1 out of Sweden, 1 out of Finland, 1 out of the state of Florida, which means there is no comprehensive lit review behind the WPATH standards of care, which shouldn't be called standards of care.
I was just going to ask you, Doctor, talk to us about WPATH for those, for those parents that that whole thing being floated, that the standards of care. So
WPATH is, they're the main drivers in the West. It is not a medical organization. It's not a legal organization. It's an activist group. And I tell that to legislators and legislative bodies as well as parliaments. Now in Europe, they give less and less respect to WPATH all the time. They hardly even mention them. Except today, information released out of Belgium, the guy who's head of their, it has an acronym. It is basically a Belgian organization that does the strength of evidence-based comprehensive literature reviews. And he said regarding WPATH's, standards of care regarding puberty blockers, if he were reviewing it, he would put it in the bin. So not real good. So WPATH is an activist organization. It is based in the US. It is not legal. It is not medical. But, they have the presentation of eminence-based evidence, if you will, as opposed to evidence-based evidence. WPATH. Well, their SOC7, let's put it this way. The first of its kind review article was done in 2021, published in the British Medical Journal. And the author, Dellin, I believe, applied rules of evidence evaluation to these different international guidelines. And man, he came down hard on WPATH. They looked at, what they consider 6 different criteria to weigh evidence. The WPATH SOC7 got 0 out of 6. That was their rating, 0 out of 6. That's what a trash document it was. And they didn't have good things to say about other ones either. But these other medical organizations in the US, the psychological organizations that are, singing the praises of gender transition procedures, none of them have comprehensive literature reviews. It's just like expert opinion, expert opinion sounds good, but it's a very low level of proof. Like, where's the data? Where did you get these opinions from? Where did you get these guidelines from? And let alone using them to interfere with state legislatures trying to protect their kids, which is why the state of Florida, and now I believe the state of Alabama, and recently I read Arkansas is doing it too, have subpoenaed WPATH, the American Academy of Pediatrics, and the Endocrine Society, saying, you will show us on the stand how you support these guidelines, these protocols, these recommendations of yours, and why you have been using it to interfere with our legislative process. It's impressive, truth's out there, and it's going to be exposed.
That is so good to hear. I'm telling you, it's really important. And the fact that WPATH has just gained such traction comes directly because of all of the big money that's funneled in there to keep the propaganda moving and to keep this whole trans movement, pushing along. It's notorious, you just don't have words to describe it.
Yeah. Professor Paul McHugh, the emeritus professor of psychiatry at Johns Hopkins, he was asked, when is this going to end, John? And in fact, pediatric endocrinologist Quentin Van Meter, at the very end of a documentary called Transmission that I was in as well. But the documentary closes with him telling you what I'm telling you right here. And he said that Paul answered, I'll tell you when this is going to end. When the children and the families that have been through this come out on the other end, don't just sue the doctors and the hospitals, but the insurance companies and the pharmaceutical firms that did this. That's when this ends. And I'm so pleased to be able to tell you and your audience, it was like a prophetic word, hearing this out of Paul, we're like hanging on to it. And just in the past year, I have been asked to help in cases doing all of this, going after the pharmaceutical companies. The Chloe Cole case against the Kaiser HMO here in California. And I think that has the potential to be America's Bell versus Tavistock, because Kaiser is a hospital chain and is also an HMO insurance, a health maintenance organization, actually the first of its kind. So boom, boom, boom. Now you're checking the blocks that need to be checked. And when it becomes evident to the hospital corporations, the insurance companies, the pharma firms, the philanthropic organizations going behind this, the corporate America, that this is not a gravy train, that in fact, when you permanently medicalize a kid, now you're going to get to pay for it. Watch how fast the social contagion quits being, I'm trans, transition me, to my life's been ruined and I'm going after the people who did this to me.
Yeah, it will be just an absolute explosion. The saddest thing in my mind is for these individuals who have been led down this path. And I said repeatedly to people in the Christian church and certainly in other faith-based religions that it's those places where people can find hope, and that we are going to be required to pick up the pieces. And one of and in such a big way, Dr. Van Mol, because psychologists won't be able to, because they're churning out psychologists and psychiatrists and psychotherapists who aren't trained. They're trained in gender studies, they're trained in all kinds of other things, but they're not training them to actually, well, and I'm saying this overall, I shouldn't make such a generalization, but I will anyways, because I think it's very true that they're not being trained specifically in trauma care and how to go deep into what has happened to these individuals in their early childhood, all of the other things that have created the mental illness, that created the gender dysphoria and all of the questioning, and that pushed these children in. So, if we as a church, a Christian church, don't have the answers to this, we need to sharpen our swords, man, because we better step up to this game.
Yeah, simply put, it seems as though Western mental health has completely lost its curiosity in evaluating underlying causes. And that's the end of them. I mean, what good are they, if you can't sort these things out? Now, I was asked to, I can't say too much about it because it's not released yet. A small international group of mental health experts, I was asked to kind of oversee this task force to generate a very concise, condensed, easily understandable set of overarching principles for evaluation and treatment of people with regret and detransitioners. And Christian Medical and Dental Association is asking the task force that I co-chair with them to come up with more, the actual, what would you do hormonally? How do you straighten somebody out? The requests are there for stuff like that, every day, as you might imagine. But one of the things, we can suggest is to the mental health professionals, look, forget about anything having to do with sexuality. What we're asking you to do with these people is evaluate them for depression, anxiety, personality disorders, adverse childhood experiences. You're supposed to be trained in that. If you can't do it, you have a problem now too. But go after those things, because that's where the money is. Who can accuse you of conversion therapy or any other false charge if you're simply doing your job of what any mental health professional should be able to do in any other client?
Exactly.
So I think that's pretty simple.
That's very good. Thank you. That is exactly what we should be doing. Well, excellent.
Yeah, people have asked me that question. I said, the way you help a kid is stop focusing on sex and sexuality, except for you want to find out if this child has been perped on. If somebody's grooming this child, and usually if you have a child, no child's going to really step forward and say, I'm being perped on.
Oh,
they
right.
drop hints, right? And so the primary one, for instance, with girls is, I hate being a girl. I wish I was a boy. And if we reframe that as mental health professionals in terms of, oh, it's gender, rather than, oh, this might be a red flag that this kid's being perped on, then we've let this kid down. This kid it's a cry for help. And what do? We're now adding insult to injury or injury to insult. So well said.
So I was at this conference in Texas.
There you go. Let's talk about it. Let's maybe we'll do about 10 more minutes, 10 or 15 more minutes, and it's all yours.
Okay. This was in Dallas, Texas, done at Dallas First Baptist, big famous church, put on by the Christian Post. And they brought together as our MC and contributor Brandon Showalter, a journalist who's made his name on covering these the trans controversy and problems, and he's also an author and involved in doing documentaries. Mary Rice Hassan, who's a lawyer and a fellow at the Ethics and Public Policy Center in Washington, D.C. Amy Ichikawa, interesting because she was herself 5 years in prison, and now she leads this nonprofit, Women to Women, that's prison advocacy for the straightforward reason here that, of course, you have biologic males that claim trans status being put in women's prisons. And now the thing is, if you're a rapist, you decide you're trans and you will be put in with the women. It's like ridiculous, shouldn't be happening. Jennifer Law, co-founder and president of the Center for Bioethics and Culture in the San Francisco Bay Area, and she's a big documentarian. Myself and Jeff Myers, Dr. Myers is head of Summit Ministries, that Christian apologetics training thing. And so, we were asked to give the lowdown. I was asked about some of the things I presented to you on these two shows about what's going on internationally, what quality are these studies when you really look at them, being able to talk about the comprehensive lit reviews and the Northern European experience, as well as, what things are difficult for me in addressing this, to the medical community, legislators and stuff like that. But the one who, and Ms. Hassan, the attorney, it was big on talking about education policy and how long this has been working up in the schools. It may seem like it hit as a big tide, in just a year or two, but the makings of it were there for quite a while, and it will take quite a while to extricate it, from the school system and from education. But Amy Ichikawa stole the show. There was a New York Times reporter there, as well as Fox News and some Christian media. But it was reported to me that the New York Times reporter was really taken with what Amy was talking about. That who's standing up for these women. And in the specific cases of these women she's trying to represent, working with in California prisons, who don't sleep anymore. A rapist has been put in their cell block, and someone has to stay awake all the time to make sure things are okay. And these trans women, come in with the anger and the violence and want everything to be, their way. They claim to be women, they want this show to wrap around them and their way of doing things. And they bring in corruptions in male prisons that don't exist in female prisons. For example, in female prisons, there's no race segregation. The women all get along. The race means nothing to them. But in male prisons, there's self-imposed strict segregation. And so these, so-called trans females want it to be like that there. So in the TV room, it's whites in the front and blacks in the back. That doesn't happen in women's prisons. And of course, that's the least of your problems when you're talking about, somebody who rapes women being put in a women's prison. Now, the counter argument is always, you're anti-trans, you're the reason they kill themselves. It's like, excuse me, you're not paying attention. You're taking an individual who rapes women. Whatever else you have to say about it is irrelevant. And you're putting them with women. The at-risk population has now been put at higher risk. Why is this so hard to see through? And in the UK, they were doing the same thing, but when enough women were raped in prison, they reversed it. Now they don't put trans females, so-called, in with the general prison population of women. But we're doing it in California, and apparently the legislators just feel grand about themselves about it.
Well, as a woman, I can tell you that it boggles my mind when we cannot learn from other countries, and we cannot take that information and assimilate it and say, well, if this has happened in UK prisons, do you think we shouldn't do that here? And it just, not only that, common sense. These are men who are identifying as cross-sex, as women, but they haven't gone through sex reassignment surgery.
Oh, that's right.
I mean, these are men. These are men.
One guy in particular, one main guy she was referencing, who he killed a woman and her child,
Oh my goodness.
He mutilated his genitals right before. And, hey, I'm trans and here's the proof. And what's worse is he got a job in the electrical shop, and the method by which he killed the mother and her daughter was to electrocute them. This is amazing. You can't make this stuff up.
I'm confused here. This was in the prison that he did this?
No, that's what got him in the prison. But then he was able to get assigned to the electrical shop in the prison.
Oh my goodness.
A convicted rapist and murderer who used electricity to kill his victims.
We've lost our ever-loving minds. What's wrong?
And people don't know. The general public does not know. And what they do know is sold to them, under another, banner. So it misrepresents it. It diverts. But as this information comes out, hopeful, Lord willing, this will be the end of it. But again, it got the attention of the New York Times reporter, who was probably there to do a hit piece and found something else to take away. And there's been an article in Fox News, another one in the Christian Post, about that presentation we did just, a week before this one. So it's already bearing some good fruit.
You were very kind, because when you're telling us the public doesn't really know, and you're right about that, and yet do we not know enough not to put men with women in such circumstances? I think all of this is going to come back on the prison system too. We are anyways. I better stop there. I'm finding myself getting very annoyed more than that. Anyways,
having worked on psych staff in prison for 11 years, I tell people this straight up, that the only men that would ask to go into a women's prison are those that intend to rape them. 100%. I say, if any federal, state, or provincial system wants to prove me wrong, at your expense, fly me out. I'll do a deep dive into the backgrounds and records of every single man that wants to transfer, and I will find, without exception, that they have harmed women. Those that are quote unquote trans, the genuine, but they don't want to go to a woman's prison. Why? Because they get preferential treatment, they're safe, and they get attention from the other inmates. They're typically arrested for prostitution in some capacity. And so they don't feel threatened. I'm telling you, I had 5 on my caseload. They're given preferential treatment. So I know what happened. And they know that no guy would presume to put women in a stressful or a duressful situation like that. And so the reality is, the ones that are asking to go into the women's prisons are not going in for safety, but to traumatize and taunt and gain access to the private spaces and private parts of women.
Yeah, this is bad news.
Yeah. Dr. Von Mol, you're talking to parents and grandparents and others that, again, may not have much of an in-depth knowledge. All they know is what they've heard. What message do you have for them about just the overall the trans movement and the fallout and the implications? What do people need to understand from a physician's perspective?
Yeah, again, there's always a more honest way of dealing with gender confused kids than chemical sterilization and surgical mutilation of very healthy young bodies for what is essentially a mental health problem. Be aware that transgenderism has been presented, out there as the catch-all diagnosis for any kind of emotional or psychic stress a kid is having, and that transition is being promoted as the cure-all solution. And it's not, and every kid's uncomfortable. They need to understand that. I mean, social anxiety is the most common thing you can find in junior high. It doesn't have any other implications. It doesn't mean you're trans, as though you could, it's biologically impossible to be born in the wrong body. And transgenderism is an ideology. Gender dysphoria is a diagnosis. And there's stuff we can do for those, diagnostic entities. And the fact being, if mental health evaluation and support were only as effective as gender transition procedures, it would still be superior, because it leaves the body intact, the fertility is intact, the sexual functions intact. There's no reason to be doing these to kids at all. It's experimentation, unproven, unmerited, and it will not stand up to the scrutiny when the proper light of truth and science is put on it.
Well, yeah, thank you. I think that, and I really hope that a lot of parents are watching over the next few weeks, because I think what they're going to begin to understand, if they don't already, is more of the deeper dynamics. And what you've just shared was phenomenal. I just want to thank you so much again, Andre.
Thanks for having me on.
Likewise. Dr. Von Mol, how can people get a hold of you?
Getting a hold of me is going to be kind of tough.
Okay, well, they can pass word along through us, but are there videos, a website? Is there something you can recommend where people can review more of what you have put together?
Yeah, you can go to cmda.org, for the Christian Medical and Dental Association.org, and look up their position statement and ethics statement on these issues. Type in my name on the search engine, and most of the stuff I've written would be there. Look up my name on YouTube, Bypass the Haters, and you'll see some legislative testimony and different interviews like this one, that's there. Several of us have written for the public discourse, whatever it is, .com.org, sorry, that comes out of New Jersey, articles there. So, it's around. And the American College of Pediatricians, acpeds.org, they have a lot of good stuff on their website also, and whole page sections devoted to this. Plus, we're in the process of putting together an information site separate from the academy, exactly for parents to be able to look into and have everything kind of one-stop shopping.
That's excellent.
Wonderful. Well, thank you so much for your time. You've been very generous, Doctor. And this is the issue of our time. It's decimating kids, decimating families, and now it's become a public safety issue because of, as we saw, that trans shooter. So thank you so much. And Brad, thank you as always for hosting us and facilitating this. We could not do this without you.
Thanks, Jon. Thank you, everyone, for joining us today. Dr. Van Mol, we appreciate every word of wisdom that you've brought to the table today. Dr. Ann Gillies, as always, a pleasure to have you on the show on a regular basis as co-host. And Jon, well, what can I say? We started this for a purpose, and the purpose is to help parents, help grandparents and children alike get educated on what this trans movement is all about and how evil it truly is. Remember, you can find us at our BitChute channel, Unmasking the Trans Movement, or see our website at unmaskingthetransmovement.com. All kinds of resourceful information found there for parents, grandparents, and children alike. I'm Brad Wilder. Remember, it's not your kids' fight, it's our fight. I'll see you next time.